Good day to all of you. Thank you for joining me. I really appreciate you being here today because I know many of you, if not all of you, are on vacation. So to take time from your vacation to be with me, I greatly appreciate that. And today is a new webinar. It's actually remodeled from a couple, 3 years ago, but there's a lot of new content in it. And so I'm glad to share this with you today. Uh, as you can see, the topic is brief evidence-based drug use prevention for classrooms as well as one-on-one or individual with individuals. So my name is Dr. Chudley Wirch. I'm the founder and CEO here at Prevention Plus Wellness, located in beautiful St. Augustine, Florida. Thank you for joining us. And so we'll have this hour together, and this is your time. So if you have things you want to say, critique, comment, question, go to the Q&A. See if you can find that in your toolbar. That's the best way to communicate because everybody else is saying hi on the chat space. So if you can find the Q&A in your toolbar under the More heading, I think then that's the best way to ask questions, make comments, and we'll address those at the end of today's session. Okay? So let me, introduce the session objectives. So this is for you guys. At the end of today, you'll be able to identify various screening and brief intervention, that's SBI, screening and brief intervention, practice models. So we'll look at different practice models for SBI for preventing substance use misuse. That's preventing and intervening, prevention and intervention. You'll also explore evidence supporting SBI, screening brief interventions, and the challenges associated with typical SBIs for preventing youth and young adult substance use misuse. And then lastly, I'll be presenting to you the Prevention Plus Wellness SBI model, which you can use for preventing youth and young adult substance use misuse, both in groups or classrooms, as well as individually or one-on-one. So before we go any further, before we dive into the content, and I show you the slides, let's go ahead. I've got a poll I want to share with you. You know, I oftentimes have a poll, and this one is an introductory poll. I just sent it out to you. I encourage you all, if you are on a computer or device of some sort, to participate. I know some of you are called in and you can't participate because you're on a phone, but you don't have access to participate. But if you can, I encourage you to do that so we have everybody participate and see who's on today and what your interests are. We can tailor the training a little bit for today. So I think there's only 4 questions, 3-4 questions. So you'll have to scroll down to see each of the questions, and some of them are a single answer and some are multiple answers. So please do take a moment. We got over half of you have already participated. I'll just give you another minute or so we can try to get more of you to participate, as many as possible. We got 6 out of 10 of you participating. That's amazing. That's fantastic. And I really appreciate you all participating, taking time to do that. So that's a wonderful. And so just another 30 seconds or so, we're already up to 70% of you, 7 and 10 have answered the questions, which is great. Another 15 seconds or so in case a few more of you want to participate. And so 70% that's where we're going to stay at. We're over 70% now, which is fantastic. Thank you all for participating. And give me just 10 more seconds because I know some of you are in the middle of participating, I see. And we're just shy of, we're at 75%. So 3/4 of you participated in the survey, this poll. Amazing. I'm going to end the poll at this point, and I'm going to share the results with you. So send them your way. So let's take a look at them together. First question is, have you ever been trained or implemented a screening or brief intervention? And not surprisingly, over half of you, 57%, have said yes. But another good chunk of you, over a third, said no, but you'd like to. So perfect. This is perfect for both of you, both of those groups, I should say. So welcome to this training, this introduction to, for those of you, and maybe just an expansion of what you already know about screening and brief interventions. Question number two, which of these screening and brief interventions have you heard of? So you got motivational interviewing. 75% of you have heard of that. So that's the most well-known, and that's followed by SBIRT, that's screening, brief intervention, referral to treatment. Almost half of you have heard of that. Prevention plus wellness. There you go. Almost half of you have heard of that. And so really sort of surprised that more of you heard of motivational interviewing than SBIRT. So that's fantastic. You'll be introduced a little bit more to both of those today and more. Question number three, what age group of individuals do you provide prevention services for? And most of you work with high school youth, 86%, and that's followed by middle school and elementary school. Some of you also work with young adults. Half of you work with young adults, and over a third work with adults. So we've got a whole range. And SBIRT, or motivational interviewing, or screening and brief interventions, generally, including PPW, prevention plus wellness, can be used in all of those age groups. And that's it. Those are the questions. Fantastic. Thank you again for participating in that. So let's dive in and look at screening and brief intervention practice models. So if you were to search online for screening and brief intervention, you'd see a number of terms or models. You'd see BI being used quite a bit. That's just brief intervention. That's a broader term. That could be just about any intervention that's short in nature, but oftentimes used interchangeably with SBI, which is screening and brief intervention. That's obviously a specific type of intervention because it includes screening. And then number three, SBIRT, that I said earlier, that's SBIRT is screening, brief intervention, SBI, and referral to treatment, or as sometimes referred to now, referral to further services or assessment or counseling, whatever the case might be. So it doesn't necessarily have to be referral to treatment. It could be just other kinds of services. We'll talk more about that shortly. Motivational interviewing, that style or that approach to counseling, open-ended counseling. SSI, some of you may have heard of that. SSI is single session intervention. That's used more often in the mental health area. I'll talk a little bit more about that. And of course, PPW, prevention plus wellness. All of these programs are screening and brief interventions. PPW are screening and brief interventions. So that's why we're talking about these today. These are different models, different terminology. And so, quick introduction to screening and brief interventions. Screening and brief interventions, including motivational interviewing, including SBIRT, have a decade-old history of success in the scientific journals. They're identified as a whole, screening and brief interventions as a whole, as evidence-based practices. That's above an individual evidence-based program or strategy. So again, evidence-based practices, screening and brief interventions, including motivation interviewing, SBI, different kinds of strategies or practices, all considered evidence-based practices. And then there was a very informed comment that these strategies, these practices, these interventions can increase public health reach and broaden youth populations, broaden access to youth populations, so you can have full public health reach, primarily because of the brevity. So youth screening brief intervention referral to treatment. What is it? Here it is. There's an overview for those of you that are not familiar with the SBIRT model. Again, refers to screening, brief intervention, and referral to treatment. That's SBIRT. And this is a practice that's designed to reduce substance use, and it's equipped and has been used primarily in clinical or medical care settings, primary care settings, behavioral health, clinical settings, and it has three components to it: screening of youth or young adults, or adults for that matter, to identify those individuals on a spectrum of non-use of a substance to current use. Secondly, to provide brief intervention, particularly toward those using and then also trying to use or starting to use, and those using regularly, and then for those at the highest risk, referral to treatment or additional services. That's the three-step process. As I said before, screening and brief interventions in its various formats have been identified as evidence-based practices by a whole bunch of national, international organizations, including SAMHSA, the Substance Abuse Mental Health Services Administration, Centers for Disease Control, World Health Organization, National Institute on Alcohol Abuse and Alcoholism, National Institute on Drug Abuse, American Academy of Pediatrics, and others. So lots of support, lots of identification as practice, evidence-based practice by lots of different organizations. So now let's take a look at research supporting SBIs for substance use intervention, particularly for, well, just generally, first of all, with this one slide. So this was a review of research, and it's somewhat old now, it's 2008, and it looked at SBIRT, screening, brief intervention, referral to treatment, by Thomas Weber and his colleagues. And I wanted to show this because even back in 2008, there was already 25 years of research that supported SBIRT as yielding at least short-term improvements in individuals' health. And the researchers said this evidence is irrefutable. And of course, that's 2008. And since then, there's been a bunch more research that has supported screening and brief interventions. And so let's take a look at some of this SBI research for youth substance use prevention and intervention. Let's take a look at the youth research. So here's, and most of these, by the way, I think if not all of them, are reviews. So rather than an individual study, they're a compilation of looking at multiple studies. So it's a little bit broader, a little bit more comprehensive statements about the science at this point. So this review addressing substance misuse in adolescents, and they reviewed research on SBIRT, and they found that recommended that pediatricians should use screening for adolescents in every well exam and acute care visit. And they also concluded that SBIRT is an effective method to address adolescent substance use. And you'll see a lot of this, that screening and brief intervention in general, SBIRT particularly, motivational interviewing particularly, focused on and being used within healthcare, behavioral health, clinical settings, even acute care settings. Here's this, again, another review. This is a meta-analysis. This is a type of review where they're running certain kinds of statistical analyses across all the studies reviewed. And this is on brief interventions for substance use in adolescents. And they looked at adolescents ages 12 to 20 years old, and they found that motivational interviewing, if I could just take a moment, that's a counseling strategy, a counseling skill that you use usually with your patients, and MI was found to reduce heavy alcohol use days of use, and substance use related problems in adolescents. This was a review of research on single session interventions. That's at SSI, single session interventions. And SSIs were found to have evidence that supported them to reduce and to prevent youth psychopathology of multiple types. So SSI, again, is a type of brief intervention. That term SSI is used primarily within the mental health clinical field. And so you've got, again, these brief interventions, whatever you want to call them, whatever terminology you use, are in reviews of research are found to be effective. In this, SSIs effective in reducing and preventing mental health problems. Brief interventions for cannabis use in emerging adults, in other words, young adults. Brief interventions here were operationalized, in other words, defined as either 1 or 2 sessions. Can't get much briefer than that, 1 or 2 sessions. And the review of research found that existing brief interventions show benefits for symptoms of cannabis use disorder and abstinence, and also promising other outcomes. So brief interventions among young adolescents, young adults were effective for preventing cannabis use disorder. Screening of brief interventions is a newer study looking at screening of brief interventions with low-income youth, adolescents. They looked at youth ages 16 to 24, and they looked at community-based screening, SBIs, screening brief intervention referral to treatment, and they found positive outcomes, both in reducing risky substance use, but also, in addition, improved education and employment. So obviously we see that, and we hope for that as prevention and health specialists, that preventing substance use, reducing substance use will also improve other aspects of individuals and communities and families' lives. In this case, we have evidence of improving educational employment outcomes because of perhaps the reduction in risky substance use, and that's because of screening and brief interventions. This review of research, and this is not a review, this is actually a study, looked at universal school-based SBIs for prevention. So SBIs is used primarily, as I said earlier, you'll see it used more in clinical settings. And this is a unique study where SBIs was used in high schools without school-based clinics. So if you would see SBIs being used within the school-based clinics. This was not. This was in the classroom settings, and they found that the universal SBIs for all kids in high school had potential to delay substance use among current abstainers. So in other words, SBIs had some potential for having prevention effects. So SBIs feasibility as a universal method in high schools without school clinics was shown to be a possible prevention tool. Alcohol brief interventions for adolescents and young adults. This was a review. Adolescents and young adults were both studied. Outcomes for brief interventions were found to last up to a year later. That's quite good for considering brief interventions being as short as a single session. Goal setting was found to be associated with the larger effect sizes. So when you have a brief intervention that has goal setting, that's a good thing. And this was one of the first and few reviews or studies that actually had some brief interventions implemented in a group setting rather than one-on-one, rather than individual, because most of these brief interventions, screening brief interventions, SBIs, motivation interviewing are one-on-one. So this review actually showed that there was some group implementation of screening brief intervention. And that takes us to sport. Sport prevention plus wellness is our adolescent, although we have high school, middle school, elementary school versions of sport, different scientific publications identifying, presenting the outcomes from clinical trials. And you can see some of the outcomes from sport. By the way, sport is an acronym. Doesn't mean necessarily sports alone, but, and we'll talk a little bit more about that in a minute. But these are some of the outcomes that are compiled across all those publications, all those studies. At sport was shown to reduce different measures of alcohol use, quantity, frequency, alcohol problems, improving physical activity. That's very unique. That's because prevention plus wellness, screening and brief interventions address physical activity, nutrition, sleep and stress control, and the prevention of substances. So you'll see for PPW SBIs, you'll see outcomes on promoting health behaviors. Sport was successful in reducing cigarette smoking with some effects a year later. There we're seeing that even a year later after a single 45-minute motivational lesson. 1 year after outcomes on binge drinking, smoking, marijuana use, increasing physical activity, increased parent-youth communication. And then we had one more recent trial where a nurse working on her advanced degree in nursing translated sport into Turkish language in Istanbul, did a controlled trial and found outcomes on a number of health behaviors, including physical activity, nutrition, health responsibility, and mental health. So those are some of the outcomes of sport. We also have In Shape, PPW, Prevention Plus Wellness, which is a screening and brief intervention for young adults. And across all those publications, all those scientific journals, we see a range of outcomes, including a reduction in frequency and heavy use of alcohol, a reduction in drinking and driving a year after that 50-minute lesson, reductions in initiation quantity and heavy use of marijuana. You can see the outcomes, increasing sleep, exercise, healthy eating, improved quality of life, less intentions to use. So a range of outcomes from sport and In Shape, prevention plus wellness, screening and brief interventions. Also on our website, if you go to preventionpluswellness.com and you go to resources, you'll see these real world case studies. Well, rather than those clinical trials that were published in scientific journals, you can read actual reports of regular, non-research based, but real world case studies of prevention plus wellness, screening and brief interventions being provided by prevention and health specialists like you, organizations like yours across the country, and we present them on our website, preventionpluswellness.com, resources, and go to real world case studies. And at the bottom there's the link. And so when I send you these slides, or when I post these slides, if you want to click on that link, you can go directly to these case studies and read them. Now, I think it's important to compare and contrast typical screening and brief interventions with prevention plus wellness screening and brief interventions. So on the left-hand column, you've got typical screening and brief interventions. On the right, PPW screening and brief interventions. So starting on the left, typical SBIs target substance use, typically one substance use. Whereas if you go to number one to the right, PPW SBI targets not just substance use, but as I said, health behaviors, HB, physical activity and sports, breakfast and nutrition, sleep, stress control. So there's a dramatic difference right there. Typical screening and brief interventions where the motivational interviewing, whether it's expert, it doesn't matter. will typically focus on a single substance. PPW screening brief interventions will focus on one or more substances, but then also on multiple health behaviors. Back to number 2 in the left-hand column, screening and brief interventions typical screen to determine substance use risk level, and then tailor intervention messages for youth based on that screening. So if they're found to not be using, let's say they're screening for alcohol use, if they're found not to be using alcohol, then normally there wouldn't be any communication, or they'll focus on those that are using and those using heavily. Number 2 in the right, PPW, screening and brief interventions. Screening is done for a different purpose. Rather than screen to identify high risk, you screen to increase youth awareness or reflection on their health habits. Now, there is an option for a validated screener within PPW SBI. So you can also, if you implement PPW SBIs individually, you can also screen to identify youth at high risk. Go over to the left-hand column again, looking at typical SBIs. Number 3, they use risk-based content, assuming ambivalence. Number 4, they provide feedback regarding personal or normative risk or impairment to those for those at high-risk substance use. And number 5, they provide advice and change options for those at higher risk. To the right, number 3, PPW SBIs use a different model. They use focus on positive and future images based on the behavior image model. That's the model underlying conceptual model, which we'll talk about. Number 4, PPW SBIs provide substance use prevention and health behavior promotion feedback for all youth. So all youth in PPW SBIs will receive prevention messages and health promotion messages. That's a dramatic difference from typical SBIs. Again, typical SBIs will screen for high risk, give messages primarily to those at higher risk. PPW SBIs, everybody gets prevention messages, everybody gets health promotion messages. So it is a true prevention and health promotion intervention. And number 5, PPW SBI provides health behavior recommendations and multiple behavior goal setting. There's that goal setting, which we found in one of those reviews of studies that shows an increase effect sizes. And then continuing on, comparing and contrasting, left-hand column, if I just go down the left-hand column, typical screening and brief interventions involve unstructured, client-centered interview, particularly motivation interviewing. You refer high-risk individuals to treatment or additional services. Number 8, you are typically providing within teachable moments or opportunistic events. That's why they're presented in primarily in primary care settings or in clinical settings where there's injury, for example. Number 9, usually provided in clinical settings. There you go. Number 10, usually results in single behavioral outcomes. And then lastly, indicated prevention level. This is really typical screening brief interventions are really considered indicated prevention. They're intervention, although we saw some evidence that they may have in some settings also have prevention outcomes. Now, if you look at the right-hand column, starting with number 6 in the top, these are PPW, Prevention Plus Wellness SBIs, involves structured protocol, scripted protocol, opposite of an open-ended strategy, a clinical practice. You actually, with the PPW SBI, it's a manualized, scripted protocol. Number 7, you follow up with resources and recommendations. You can refer for additional services if you want. Number 8, provided anytime. And in fact, most often it's provided, PPW SBIs are provided more often than not in school and community settings, Boys and Girls Clubs, YMCAs. It's not limited or even focused on clinical settings necessarily. Number 10, targets multiple health behavior, change outcomes, and lastly, Most PPW SBIs are universal prevention interventions, but are used because of the potential for larger effects on substance use in youth as selective and indicated interventions as well. That's why PPW SBIs are used in school diversion programs, for example. What are the challenges to typical screening and brief interventions? They require substantial training and skill development. Motivational interviewing requires hours of training, maybe even days. Same with SBI. And their implementation can be time consuming. Not that the intervention is time consuming. It could be as short as an hour or a single lesson or two lessons. But when you present it to individuals one-on-one, that may be impractical in some settings, like schools, for example. Typical screening brief interventions do not typically provide or ever provide prevention messaging. They're an intervention. They're looking for identifying higher risk youth and trying to and then providing intervention for those youth. So, and typical SBIs don't address substance use protective and mental health enhancing health behavior focus, which can increase the interest and salience and potential for stronger, broader outcomes that you see in PPW SBIs. What are some advantages, therefore, in PPW SBIs in terms of implementation? They're a single 45-minute session. Most of them are. You can't get much briefer than that. You have a protocol to present them in a classroom or group setting. Very unique. You see very few protocols, or even recommendations or opportunities to present screening and brief interventions in a group setting. And when you do, it's limited to a very small group, a handful of similar, whereas PPW SBIs have been implemented in any group or team or classroom setting. PPW SBIs also have an individual protocol. They can be implemented following that protocol, and they can be implemented as an expert. So PPW SBIs can be implemented because they include a validated screener called the craft, and so you can implement them one-on-one as an expert if you wish. Then lastly, number 5, we have new versions of our manualized programs in an interactive online course. These are unique, and so you won't see many of these as well. So you've got a PPW expert in an online format for youth. Other advantages of PPW SBIs, they allow true prevention for all young people receiving the PPW SBI. Greater effect sizes were found for those already using alcohol or drugs. They target the promotion of healthy behaviors, which are linked to improved mental and physical well-being, performance, and happiness, and may also increase interest and salience, not just among the youth, particularly when you get to older youth, older middle school and high school youth. They have heard prevention messages before, so you have a broader message with PPW SBIs that focus on health behaviors and desired future images, and this is very salient, very pertinent to them, and they're more likely to listen to these prevention messages because they're couched within a health promotion context. Also, there's some real advantages to PPW SBI training. So training time is extremely reduced because training time, as I said, for motivation interviewing expert can take hours, can take days. The training that we offer literally can be done. We have an online self-paced training that literally can be done within a couple of hours because the programs, PPW SBIs, are scripted. So that allows for reducing training time that makes it more practical for prevention and health providers. In fact, you don't need number 4, you don't need an advanced degree or training. We have had young people trained to provide PPW SBIs to their same age or younger age peers. So it's a great youth leadership experience. And as I mentioned before, PPW SBIs have protocols for implementation in group settings, including existing classrooms, very, very unique, very practical, efficient, as well as online, and even online, or excuse me, as well as one-on-one or individually, even as an expert. And then lastly, even online. And the online version does not require any training because literally the online interactive PPW experts are self-administered. So lots of opportunities for practical training and implementation with PPW SBIs. What are the components? Some of you may already know this. For those of you that were introduced already to Prevention Plus Wellness, Screening and Brief Interventions, three-step process. You screen youth to increase their awareness, their reflection on their health behaviors. But if you implement this one-on-one, individually to youth, you can also use the validated screening to try to identify youth at higher risk of substance use. Two, you provide feedback that targets positive desired images of themselves in the future, driven by PowerPoint slides. You read the script, designed to integrate how substance use interferes with the health behaviors and their desired future images. This increases motivation for change across a number of health behaviors. And then step three, you capitalize on that by initiating the behavior change process by having them set goals, not just to avoid substance use, but to increase protective health behaviors. And that increases self-regulation skills and self-efficacy. So screening, feedback, and goal setting. And remember, goal setting was found to be a critical component in increasing effect size in screening and brief interventions in a previous review of research. The basis, the conceptual basis for PPW screening and brief interventions, unique to other screening and brief interventions, is the behavior image model. It's a wellness-based theoretical model, and it's designed to integrate the promotion of healthy behaviors, physical activity, sports, sleep, nutrition, breakfast, stress control, and substance use prevention as well. And the three main components, we've already talked about them, really screening, communicating, aspirational, positive, desired images of themselves and their peers, giving them an opportunity to set goals to initiate behavior change and to change your actual health behaviors, improving healthy habits that help reduce substance use and improve mental health, as well as avoiding substance use, and then supporting that over time, supporting that in any way you can with additional goal setting opportunities or parent communication or media campaigns or anything like that, just continued support for youth. PPW SBIs, we have a wide range of them. Here's a list of some of them. We have the sport, as I had showed you the research on the sport, alcohol, drug prevention plus wellness. We've got high school, middle school, elementary school version, in shape for young adults, and sport, alcohol, cannabis is an adaptation of sport. The marijuana prevention plus wellness SBI for adolescents and children, vaping, PPI, e-cigarettes, opioid PPI. So we got all these adaptations, which, by the way, we created because providers like you requested them of us. So if you need something from us, we listen to you, and this is how our listing of various programs and strategies has increased over the years because of providers like you working with us. Sport 3 is a 3-lesson program, alcohol, marijuana, and e-cigarettes. So the top 3 substances are addressed in 3 weekly sessions, or individually if you want, or in different combinations. Sport health behaviors is 6 sessions. Is healthy behavior forward, physical activity, nutrition, sleep, stress control. It's more like a health education program with drug prevention. And then alcohol and stimulants, PPW for young adults. That's our second young adult program in addition to In Shape. So these are some of the programs that we offer that are all considered screening and brief interventions. By the way, all of these programs have been updated for 2025. New materials, new content. new slides in some cases. So let's take a look at sport, high school. There's a new cover manual. We've got a middle school and elementary school version, but let me walk you through it so you can see what we're talking about when we talk about a PPW expert. So you've got introduction, you've got the group script. That's unique to screening and brief interventions. Very, very few, but the research showed that group interventions and our case studies show they can be very effective in addition to being very efficient. Individual script is section 3, and then all of the appendices, all of our, so you get a manual, either physical or digital. This is, the cover of the manual. This is a table of contents. All the appendices come in a download, a digital download. So you have your physical manual with your group script and your individual script. Again, either physical manual or digital, and then you follow the scripts, and you can download or copy all these things, your appendices, your reproducible materials, and implement this to any number of youth for as long as you want. But that's how it's laid out, the new 2025 manuals for most of them. So there's the group script. The content, the directions are provided. Use the script below to deliver the lesson to 2 or more individuals, because this is a group script. Directions are in parentheses. And so you can see this is a different layout for those of you that have used PPW SBIs before. You've got the directions, and you've got the script to the left, and then to the right, you've got the corresponding slide. So it makes it even easier for you to practice and then to present to your youth, to your young adults, to your children, or whoever you're implementing this to, one-on-one or in a group. But here's the script. You can see it's italicized. Hello, for the next several minutes, I'll be talking to you about sport, prevention plus wellness, exciting new fitness and health program. And together, we're going to look at how habits can make you look better and feel better and improve your performance, not just in physical activities, but school and relationships. So there you go. You get a script. You can use your own language, if you will, but there's the script. Makes it much easier to be trained, quicker to be trained, and increases fidelity across implementation. And here's the individual script. So the main difference with implementing this individually, one-on-one, is the feedback is tailored to the screening survey. So, for example, if the young person said yes, they get sports and physical activities, and you'll read the benefits of sports and physical activities to them. If they said no, you read the no response. So you read one or the other. So there's a little tailoring. So, for example, if you look, by the way, you see green, good, go, yes, they get sports, physical activities. No, they don't get physical activities. And see the script as I see you may not play sports or participate in physical activities. You can really improve your health and how well you feel by being a little bit more active. So you can see the feedback is either going to be neutral, like that, nothing negative. So you don't want to tune anybody out from listening to your essential prevention messaging, but it is going to be tailored and either be positive or be neutral. There's the slide. What sports, physical activities did you play in the last year? That's also the first screening question. I'll show you that right now, because here's the sport slides, some of them at least, sport prevention plus wellness screening brief intervention slides. The first step, as we said, was complete a screening survey. You could even have them completed if you present. You can present this lesson virtually, let's say on Zoom or Microsoft Teams, and they could click on this link to the right, and that'll pull up a screening survey. They can do it on their own if you want to present this live virtually. So you have great flexibility with implementing our PPWS screening brief interventions. What sports or physical activities did you play in the last year? It's a 2-step messaging process. There's the benefits, there's the positive benefits, the outcomes. You're trying to increase expectancies, positive expectancies about these health behaviors. Sports, physical activities, nutrition, breakfast, sleep, stress control, and you use positive image terms like look fit and strong, which unconsciously increase motivation for change. And then you mentioned secondarily how alcohol and drug use interferes with achieving those behaviors and those benefits and those future images. And so that's the process. And then you go on to talking about regular sports and physical activities. There's the benefits: promote a healthy heart and lungs, control weight, feelings of success and well-being. And then we build in more stop and think questions, more reflection questions, continually trying to have young people, or giving opportunities for young people to reflect on their own health habits. That's essential to behavioral change. What types of sports or other physical activities would you like to try or do more of? Pause, let them think about them, ask them, get them to reflect on that. And then again, how substance use interferes with them engaging in regular physical activity, and that continues. Do your friends influence you? So there's this environmental question for the high school version of our programs. There's a nutrition question. This one is on breakfast, because breakfast is critically linked to other health behaviors, including mental health. You usually sleep 8 hours, essential to performance, to avoiding substance use and the mental health. During the past 30 days, what's the greatest number of alcohol drinks? So we do ask them a substance use question. That's the screening surveys. That's the screening survey built into the high school version of sport. Obviously, the screening survey will differ a little bit from one program as PPW expert, PPW SBI to another. But if you implement this as an expert, then you could follow the screening survey, PPW screening survey, with the craft screening survey to identify youth that are at highest risk for substance use. And then at the end of this feedback, you can refer them to additional services if you present your lesson to them or your SBI individually. And then recommendations. This really highlights a major difference with SBIs and PPW SBIs, because you're focusing on more of a holistic health: sleep, breakfast and nutrition, physical activity, and stress control under number 4. And most importantly, avoiding all of those substances that can interfere with you achieving the best version of yourself. And then complete the goal plan to initiate the behavior change, increase self-regulation skills, self-efficacy. You can even do it virtually. And the new version of our programs, which we think is going to be very popular, is going to be these interactive programs. There's a link if you want to pull it up and read more about it when we post this for you, these slides. But here's a version where a teacher, a coach, a counselor, a nurse, whatever, can have a group of kids, if they have their devices, if they have their Chromebooks, they have their smartphones, you can give them a key, they can pull up their course, and they can take this interactive course, highly interactive, lots of interesting games and activities and quizzes. And you as the teacher don't need to be trained, you just need to go through the course yourself first, and then you could help your youth go through it. You could also use this, send the link to individuals to youth as an assignment. They can take it on their own at home, in a school setting, in a group setting, in a team setting, or as a diversion program. They can go to the office, principal's office, they can sit down and they can take their course as a part of their diversion process without having to have somebody there to present it to them, because they can take it on their own, and it spits out at the end the goal plan, the calendar log, and a certificate that shows that they've gone through successfully completing this online course, whether it be sport or vaping, or, by the way, those are the two we have right now in an interactive format. If you wanted one of our other programs to be in an interactive format, ask us, we'll create it for you. So in conclusion, as we wrap this up, there are a number of screening and brief intervention practice models that I presented to you that can be used for substance use intervention, but only one, Prevention Plus Wellness, that really focuses on giving everyone the prevention messages and only focuses on, and also focuses on promoting protective health habits that reduce substance use and improve mental health, performance, and happiness. Now, research has been out there for decades and decades that supports the efficacy of screening and brief interventions for adults and for youth in clinical settings, more recently in school settings, and even a little bit of research supporting them in group-based school settings. And there's important advantages to PPW SBIs that we talked about in terms of their focus on the health behaviors and their focus on their brevity and the fact that they're scripted and the training is so practical and that you can implement them not just one-on-one, but also in group or classroom settings. If you want to learn more, there's a list of our program and training. You can get a program sample. Any of our programs, just request it. We'll give you a sample. We're at preventionpluswellness.com. That's where you'll find our website. Remember, if you go to preventionpluswellness.com, go to resources and scroll down, you'll be able to read the case studies, and there's some other free resources for you under resources at preventionpluswellness.com. There's our phone number, 904-472-5022, or email us anytime at info@preventionpluswellness.com. And so now let's see if anybody has any questions. And it does look like there are some questions. There's some Q&A that I can pull up and read and see if I can answer for you. I'm going to leave that there in case you want to see that. If I can navigate to this, here we go. And the Q&A, we've got 3 of them. So Susan asks, will we receive a copy of the slide? So Susan, great question. Like usual, what I'm going to do is I'm going to post the slides and the recording of this webinar and a certificate for 1 hour CEU on our website. And I'll be sending you an email. You just click on that email, you go to the site, and you can look at those things and download those things. So yes, you'll be having access to the slides, to the recorded webinar, and to a CEU certificate. Jeff asked, any programs in development for youth, gaming, gambling disorder? That's a good question, Jeff, and no, not at this time. We've certainly kicked that around for a while, and let us think more about that. And if you really had an interest in this, if you really wanted to make a commitment, and I'm talking about a financial commitment. Hey, if you had a PPW expert that addressed gambling, and we're willing to, to make a purchase, that would motivate us to explore that more. So, Jeff, feel free to reach out to me on that topic at info@preventionpluswellness.com. But that's one of a handful of other programs that we've discussed here at the office as creating in the future. So thank you for bringing that up, and we'll continue to discuss that amongst us. But if you want to motivate us, reach out to us and let us know what you're thinking of. And the question becomes, Jeff, also is, does our model allow us to integrate the health behaviors with the gaming? So that would take some thinking and some work, but definitely a need for that. So thank you. And then we have an anonymous question. Is the sport interactive program considered TOT, train the trainer program? So the beauty, that's a great question. The beauty of the sport interactive program is you don't need training to implement it. It's self-implemented. So all you need are the keys or the links to share with the youth. And you can actually get them for as little as $150 a student or a youth. So it's very we believe it's going to be very cost effective to implement, and because the kids implement it, they take it themselves. It's all interactive. So we do recommend, if you're implementing it with your youth, if you're going to be presenting it, or you're going to be helping them take it, or you're going to be offering it, yes, we want you as the provider, as a specialist, to take the course yourself so you know what's involved in it. You can even ask us questions. Maybe you have some suggestions for improvements or whatever. Maybe we can tailor it for you, which we've done thus far. And so, but there's no need for training. That's the beauty of the interactive version versus our manualized programs where you as the specialist or the trained person, whoever you are, implement this to youth either one-on-one, as an expert or non-expert, or in a group. The interactive doesn't require training. Does that make sense? Let me know if it does or it doesn't. I'm happy to address that. And those were great questions. Let me see if I'm going to look at the chat just to make sure there wasn't any questions in the chat. Thank you all. By the way, I know some of you've got to go. God bless you for what you do with youth, with families, and your communities. If we can help in any way, don't hesitate to reach out to us. Remember, you'll be receiving an email from me today, and then you can go to that link and then access your today's webinar slides, recording, CEU certificate. But if you need anything, if you want us to create anything, if you want questions, if you want samples, let us help you, not just prevent use, substance use, but promote your use, mental health, and performance and happiness in your lives. So by having a more holistic prevention plus wellness screening and brief intervention. So great comments. Thank you all for thanking me. It's always a pleasure to work with people that are doing the essential work yourselves in communities, and doing such great work and having an impact on your youth. I have another comment and I have to leave. Thank you. Yes, well, if you have another comment or question, Sharon, just email us, info@preventionpostwellness.com. Okay, I don't see any others. I see a lot of thank yous. You might want to check one more time, make sure there's no other. Oh, there's one more Q&A, so let me grab that. Yes, it does. Explained it perfectly. Thank you. Yes, thank you so much. And have a great day and a great summer, and stay in touch. Make sure you go to our website, drop in your email so that you get notified of future webinars. And we'll maybe have one more this summer, and then we'll wrap it up in the fall for some great new webinars. Thanks, everyone. You're awesome. Keep up the good work. Appreciate you. Have a great day and a great summer, and stay in touch. PreventionPostWellness.com. Thanks, everyone.